So how does the bladder work? Well, it's a complicated system. All the blood in our bodies is filtered through the kidneys, and the waste products and fluid comes out into the bladder. And what's supposed to happen is that the bladder's held closed by sphincter muscles and the strong pelvic floor muscles, and gradually the bladder will fill up and fill up and fill up, and the bladder relaxes. And what should happen is, as it fills, after about a couple of hours, you should get a message to your brain that says, oh, bladder's getting a bit full now. There's pressure receptors around the bladder which tell you that there's a problem, that your bladder's full, and you should have 20 to 30 minutes to go and find a toilet. Then the muscles release, urine comes out in the toilet, everything's fine. But being a complicated system, anything that goes wrong on there can cause bladder problems or incontinence. And incontinence is a symptom that something's wrong, either with the bladder itself, or quite often it's the pelvic floor muscles that help to hold the bladder closed and in place. Sometimes it's the communication, the nerves between the brain and the bladder that's just aren't working properly. And it can even be elsewhere on your body, arms and legs. If you have a problem getting to the toilet, or you've got a problem getting your clothes undone, you could have a problem with incontinence. The definition of incontinence is any involuntary leakage of urine. So any time that the urine doesn't end up in the toilet, so it's in a pad or a little bit's leaked out here or there, that means you have incontinence. So why would we bother to talk about bladder problems? Well, firstly, it's very, very common, especially for women as we age. But actually, less than 50% of women seek any help at all with their bladder problems. And it's a really embarrassing problem, and it makes us feel depressed. It affects our self-esteem. It stops women going on holiday because they're worried about packing continence pads, or the airport scanner might see that they're wearing a continence pad, and it's very embarrassing. And women might, sometimes they feel they might smell and they go home early because they just feel awful. But the real reason why we want to talk about bladder problems is that most women can be cured or significantly improved without any medication, without surgery. Even at age 98, Cara, the Canadian doctor who developed this program, she's had a woman of 98 completely cured of incontinence, doing pelvic floor exercises and cutting down on her tea consumption. So it's not that difficult. So the research shows that 15% of men suffer from incontinence over the age of 60, but 55% of women, more than half of women over 60, will have some form of continence problem. Now, it's very common, but that doesn't make it normal. It's like, well, heart disease is common as we get older, or diabetes is common. It's not normal, and we should treat it. We should do something about it. Just because it's common, it doesn't mean to say that it's inevitable. Incontinence isn't a normal sign of aging, and it's not a reason to buy pads for the rest of your life. It is actually curable, and it's not permanent. Once incontinent, forever incontinent? No. Incontinence can be tackled really quite easily. Bladder problems are curable, and often we only need simple self-help measures.